Inflammation and redness surrounding the mouth is a perioral erythema. L1-P2 disease is a superficial skin blister. It is a localized form of 4S disease. Unlike the retail or 4S disease, the culture of blister is always positive. And L1-P2 occurs primarily in infants and also young children. Toxic shock syndrome, or TSS. This disease is a toxin-mediated disease, such as 4S disease and food poisoning. Two category form of toxic shock syndrome are menstrual TSS and non-menstrual associated TSS. In menstrual TSS, TSSD1 is responsible for all cases of menstrual TSS. And in non-menstrual TSS, two toxins, TSSD1 and enterotoxin B and C. As previously I told, 18 distinct forms of enterotoxin have been identified in Staphylococcus aureus, A, B, C, D, E, F to R. Enterotoxin B and C plus TST1 are responsible for all cases of non-menstrual TSS. TSS, or toxic shock syndrome, affect multiple organs, such as central nervous, gastrointestinal, renal, and hepatic. This disease is characterized by fever, vomiting, diarrhea, muscle pain, hepatic injury, and skin rash. Staphylococcal food poisoning. Staphylococcus aureus is a common cause of food poisoning. After conception, after ingestion of contaminated food such as processed meat, potato salad, and ice cream, the onset of disease is abrupt and rapid with incubation period of 4 hours. Antibiotic therapy is not recommended in patients with food poisoning, and treatment is based on the fluid replacement. Staphylococcal enterocolitis. Enterocolitis occurs in patients who have received broad-spectrum antibiotics. This disease is characterized by fever, abdominal cramp, and watery diarrhea. Staphylococcus aureus is a common cause of wound infection in patients after surgical procedures or trauma. This disease is characterized by edema, pain, and purulent material. Bacteria and endocarditis. Aureus is a common cause of bacteria and endocarditis. Most likely, infection spreads to the blood from skin infections. Many patients experience chills, fever, and leukocytosis. Acute endocarditis caused by Staphylococcus aureus is a serious disease. The mortality rate with acute endocarditis approach to 50%. Pneumonia. Staphylococcus respiratory. This organism can produce pneumonia. Staphylococcus aureus respiratory disease can develop after the aspiration of oral secretion or hematogenous spread from distant site. Aspiration pneumonia occurs primarily in very young age, elderly, and patient with cystic fibrosis and influenza. But hematogenous pneumonia is common in patients with hyperthermia or endocarditis. RES also can produce osteomyelitis. Osteomyelitis can result from hematogenous dissemination, or it can be a secondary infection resulting from trauma. Hematogenous dissemination in children results from a cutaneous infection and involves metaphyseal area of line bone.
Cutaneous infection is like skin infection. Cutaneous infection.
Yes.
Skin infection.
Yes. Cutaneous infection means different kind of skin infection. Osteomyelitis in adults also seen in form of vertebral osteomyelitis. The Staphylococcus aureus is a common cause of septic arthritis in young children and in adults who are receiving intra-articular injection or patients who have mechanically abnormal joints. This disease is characterized by painful erythematosus joint and also purulent material. Neisseria bolora is a gram-negative. Neisseria bolora is a gram-negative. This organism is the most common cause of septic arthritis in sexually active persons. Staphylococcus epidermidis and lognodosis can infect protestic and less commonly native heart valves. Staphylococcus lognodosis is a species of Staphylococcus that is responsible for native heart endocarditis. Although this disease is more commonly caused by Streptococcus. In contrast, Staphylococcus are major cause of endocarditis of artificial valves. More than 50% of all infection of catheter and shunt infections are caused by Staphylococcus epidermidis. The Staphylococcus epidermidis is a common cause of protestic joint infections. Many patients experience localized pain and mechanically failure of the joint. We cannot systematic symptoms in patients with protestic joint infection, and the culture of blood are always negative. 10 minutes break after that. 10%. Only 10% of the Staphylococcus aureus strains are susceptible to penicillin. Because of this problem with resistance to penicillin, semi-synthetic penicillin, such as methicillin, neficillin, oxacillin, were developed. Unfortunately, Staphylococcus, especially Staphylococcus aureus, develop quickly resistant to semi-synthetic penicillin, such as methicillin. resistant to penicillin is mediated by penicillinase or beta-lactamase. Penicillinase or beta-lactamase are an enzyme that hydrolyze the beta-lactam ring in the structure of penicillin. After it hydrolyzes the beta-lactam ring, the antibiotic is inactive. Currently, less than 10% of the Staphylococcus are susceptible to these antibiotics. Resistance to semi-synthetic penicillin, such as methicillin, methicillin, and oxacillin, is not mediated by penicillinase and beta-lactamase. Resistance to methicillin correlates with the McA gene, is not mediated by penicillinase or beta-lactamase. McA is responsible for resistance to methicillin, methicillin, and oxacillin. These genes encode a novel penicillinase binding protein called PB2A. This protein not affected by these antibiotics. Strains of Staphylococcus which possess these genes are resistant to methicillin, penicillin, and also carbapenems. Studies show that cephaloline has a good activity against MRSA strains. In this slide, you can see the worldwide prevalence of MRSA in different parts of the world. The prevalence of MRSA in different parts of the world varies. For example, in some countries such as Switzerland, the prevalence of MRSA is very low. Unfortunately, in many developing countries such as Iran, Iraq, Afghanistan, Pakistan, the prevalence of MRSA is very high. Misuse or abuse of antibiotic accelerate or facilitate the emergence of resistant strains such as MRSA. Vancomycin. Vancomycin is a drug of choice for treatment of serious infection caused by MRSA. Unfortunately, Staphylococcus aureus resistant to these antibiotics. Currently, Staphylococcus aureus resistant to these antibiotics. And resistant to vancomycin is mediated by MANA8 gene. VRSA or vancomycin resistant Staphylococcus aureus is a major concern for clinicians. Resistance to vancomycin. As you know, vancomycin interferes the synthesis of cell wall or peptidoglycan. Blocks the cell wall synthesis or synthesis of peptidoglycan in cell wall of gram-positive oxide. Generally, vancomycin is used for treatment of serious infections by Staphylococcus aureus. This antibiotic is not used for treatment of gram-negative bacteria. Vancomycin has a structure similarly to D-alanine in pentapeptide chain. Binds to the dealanine in pentapeptide and blocks, inhibit the formation of cross-linkage. Strains of Staphylococcus aureus which have a valid gene change the D-alanine to D-alanine dilactol or D-alanine D-serine. Thereby, vancomycin cannot attach to D-alanine or D-alanine D-serine because vancomycin has a structure similar to D-alanine, not to D-alanine dilactine. This substitution can lead to the resistance to the vancomycin. The common features.
خالي هاي محاضرة المايكرو كون هسه صاروخ بالستي يطيح الجامعة يخلصنا.